Hello, welcome to the Smile Spa podcast. I'm Dr. Aimee Russo-Mounger, owner of the Smile Spa in Baton Rouge, Louisiana. I'm excited that we are now starting our new and reinvented podcast, and I'm excited to have my first guest on the new podcast. I want to welcome Jude Marino, the owner of Louisiana Medical Group. He's here to shed some light on the hot topic of peptides. For an added bonus and the inside scoop, I'm excited to announce here that Jude will be partnering with me on the opening of the new branch of the Smile Spa called the Smile Spa Wellness. It's so exciting. And the topic today is very important because Smile Spa Wellness will be offering peptides as a benefit to our patients or to anyone who wants to give it a try. Hey, Jude.
Hey, Aimee, thank you for inviting me and looking forward to opening that new branch up with you.
Yes, I'm excited. So tell us first about what you do already, the
Sure.
medical group.
So Louisiana Medical Group, we are a weight loss clinic that specializes in GLP-1 medications. Many people know them as semaglutide and tirzepatide. And, we really got into it when there was a very high need. Unfortunately, it's a very expensive drug. And they, about 2.5 years ago, they came out with a coupon where you could get the drug for like $25. It was the name brand drug. And then the coupon went away and no one could afford the $1,500 cost of these medications. Insurance didn't cover it any longer for weight loss, only for diabetics. And we found a need and opportunity to help the public and go out and open up where we had compounded versions of it, where it is just the active ingredient semaglutide and tirzepatide. And we've been very successful, not only just helping our community, but trying to expand that help across the country. We're now a nationwide enterprise that can help anyone in all 50 states.
That's pretty great.
Yeah.
And so when you say that, these peptides are GLP-1s is what they're called.
Yes.
The two big names that you said that people don't ever say, but they're usually Ozempic or what's the other?
Mounjaro.
Mounjaro is the other one.
Those were the
Yes.
name brands.
Yes. So those are what most people, I think, lay people, I would say, kind of would call them.
Absolutely.
You know,
yes.
and some people don't even realize that they are peptides because
They are peptides.
Yeah.
The actual name GLP is glucagon-like peptide.
Like
That's what it
peptide.
stands for.
Gotcha. So yeah, that's interesting because I know some people will be talking about this and they will have no idea what we're talking about. So I wanted to make sure we differentiated that, or that we're saying the same thing, that those things are the weight loss drug that a lot of people are using, and they're
Yes.
using it as injections right now. That's how it usually comes.
Yes.
right?
So, there's always advances in science, and it is in an injection form where you inject a small insulin needle into your torso or into the back of your arm or into your thigh. Now with advances in medicine, they also have capsules that you can take
Oh, wow,
if you don't
okay.
like injections. And then they also have sublingual drops that you can take.
Didn't know that.
Yeah.
Good job. I didn't realize that. And so tell me the difference too. There's also some stuff you add to your medication, or to your peptides, I should say, which is what the NAD, which is a big deal too right
Yeah,
now. You can
so-
give me a little bit on that, and then the glutathione.
So the two biggest names in peptides right now that's kind of the hot trend are NAD plus or NAD plus and glutathione. So when we talk about these things, NAD is really a coenzyme. It's not really a peptide, but
Okay.
it is something that helps with energy, with boosting your metabolism. It's kind of called the fountain of youth because it is a cell regenerative coenzyme that really aids the body. And then glutathione is very similar, where it is definitely a cell regenerative. It is a antioxidant, so it helps the liver get rid of toxins out of your body.
They both sound good. I think I want both of them.
Absolutely.
Can I put all of it in one thing and get it? It's like
So-
magic.
Sometimes you can mix things together, but you got to watch how much of the concentration you're mixing. So
Yeah.
a lot of times it's really that you just do different peptides and you take more than one.
That's interesting. Definitely. Tell me about any big success stories, testimonies that you have from some of the people that have been on these.
Yeah, so we have helped a few thousand people now, and we have many success stories. I can tell you we've probably only had a handful, maybe 5 people, where one of the GLP injections did not work on them, and they still didn't lose weight. But for the majority of our patients, they've reached their goals and they get put on maintenance. You know, what we try to do is make sure that you're not on this for life. We want to make sure that you get to where your goal is. And once you reach that goal, how do you get off of it and maintain that weight loss still? So one of the things that we're going to really talk about in a minute is a new company that just came out where we are going to transition people off the actual injection and put them on a peptide that can still aid in that weight loss once they hit that goal and let them maintain.
For the maintain, yeah.
Absolutely.
So it is always scary, I think, when you lose weight, and then how do you maintain? You can't. You have to change your habits, I feel like, too.
You definitely.
Because this is a good place where you can change them, but then you can't just go back to eating burgers and not exercising and think that you're going to just keep it off, you know?
Absolutely. And,
So-
you know, what we try and strive for is those cheat days, per se,
Yeah.
where you can definitely still
Thankfully.
enjoy food. I mean,
Yeah.
we're in Louisiana, right?
I know.
So we're the food capital of the world here. So
Definitely.
we want to make sure that while you are more disciplined once you get off of it, that you do still have that, you know, I call it a cheat day, but really it's a success day. So
Yeah.
you want to celebrate your success and you want to be able to really enjoy the food that you're eating now.
That's a good way to put it. Definitely. I like that success day instead of a cheat day. I like
right.
that much better. So I know people are probably thinking, like, why a dentist is talking to you about weight loss and all those things and how they're related. But I do feel like they're definitely related because the mouth is, you know, part of our body. We have as a whole, it's connected to everything. It's actually the place everything goes in and systemically goes
Through your
all
body.
the way through the whole body, through the whole bloodstream and the whole system. So anything that goes in is going to affect everything. And it has to go in through I say it has to go in through our mouth, but we have injections, so
have
not
injections.
exactly that way. But yes, we still get affected. So there's many benefits for the oral cavity, the mouth, to have the benefits of these stronger, you know, peptides, the synthetic peptides. I think there's a lot of related. I do feel like too, the medical teams they're a little like they don't have as much access to trying to do like a big holistic way of helping people. You know, they kind of can see one thing and then they have to move on to the other, which is kind of sad. But it's kind of the place that they're in. And so I feel privileged to be able to have my own practice, and I can, even though I'm doing dentistry and I'm focusing on dentistry, I see so much when I open their mouth. There's so many signs of things, you know, or just meeting them. I get their medical history, all the things that they see, the diabetes, the heart conditions, all that stuff.
Everything's connected. And really the GLP-1s, we have plenty of patients that come in from their cardiovascular surgeons that, you know, it helps with cardiovascular disease.
Yes.
It helps with fatty liver disease. So it's a lot of different things, not just weight loss. You know, that the end result sometimes is weight loss. And, you know, we live in a society that vanity is definitely top of mind, but longevity is really, I think, where people are starting to focus, and they want to make sure that they're around for their kids and their grandkids and live a long, healthy life.
Yes, I think that is definitely something people are starting to look at. Dementia and Alzheimer's, all those are coming so much quicker. We're having so many people have heart attacks so much earlier in life, like 30s and 40s, even pass away 30s and 40s. I don't know if it's because I'm now in my 50s that I start thinking that everybody younger is what's happening here, or is it really that they're, you know, that they're a lot younger? So that is definitely part of why I wanted to start this wellness business and incorporate some of this GLP-1 peptides along with the other business that you're talking about that we're going to add in, because it helps people to live a longer life, but also a more productive, active life too. So I mean, we can live long, but nobody wants to live long with dementia.
Right.
You know, I'd rather live long and
know what you're doing.
And know what I'm doing and dancing and having a great time.
Right.
So that's kind of the way I definitely would like to be. I did look up, there were some advantages of the GLP-1 to dental specifically. I mean, it's both, it's people in general, but with the dentistry, there's of course the eating, you eat less. So, and you're not as hungry. You don't have the talk, the food talk in your
noise.
head, the food noise.
Food
they call
noise
it.
goes away. It is a hormone. It connects to a hormone in your brain that actually prevents
Food noise.
Food noise. No cravings anymore. And when we say cravings, it could be any type of craving. So not just food cravings. We actually have a few patients right now that are doing it just for addiction, whether that's alcohol addiction or drug addiction. And it is in clinical studies trying to see how it can prevent addiction.
Yeah, I love that idea for sure, to get to some of the treatment centers and give them something to help instead of just having to do it cold turkey, you know, and then reverting back. I feel like if you have something you can kind of clutch to, unfortunately, one addiction for another sometimes that they say, but this is a much better one to have than any of the other ones. So I know most of their family members would say the same thing probably. But I do think that with being able to curb your appetite some, then you can make better decisions. So if you know already that you're a person that's highly cavity prone, then and you like sugar, and if this can stop you from eating so much sugar, or just give you, okay, I'm going to eat this piece of sugar, piece of candy, and then I'm going to go brush my teeth, like just to make better choices.
Absolutely.
Overall, I think it does a really good job with that by helping with that, the cravings, like you were saying. Getting there, so people like you talked about, heart doctors, cardiovascular doctors sending people to you. The medicine that they put these patients on for strokes, heart disease, diabetes, all those, a lot of things, wreak havoc in their mouth. They're either getting a bunch of ulcers, they're dry mouth, they're full of, their gums are just like overgrowing, just like a whole gingivitis, and all that then will harbor bacteria because you can't clean it. Right. It's just this vicious circle. So if they could get off that medicine, that would be great. When I tell them, oh, we have this issue in your mouth, and like, oh, how can I fix it? I'm like, well, get off the medicine, but it's your heart medicine. So no, don't get off the medicine. We're just going to have to maintain where you are with your oral cavity, right, so we can keep your heart going, because it's more important.
And what we see with people on GLP-1s is a high majority of them are able to either reduce or get off completely high blood pressure medicine and cholesterol medicine.
That would be great. Yes, because those are not good for the mouth, for sure. The other one would be the weight loss, and I feel like that's a big one. I mean, most people, I guess, are probably taking it for weight loss, I would say.
The majority, probably.
Yeah, more than likely, probably, possibly, for sure. So a very small percentage is coming from the cardiologist, probably. But they have the advantage of losing weight, which also, once you lose weight, I feel like, I would hope people are more apt to exercise, move around.
Well, it's easier for them, for sure.
And easier to move.
And,
yes,
one of the ones that we see a lot of are the orthos. Orthos send people to us because it's bad. Extra weight is bad on their joints, bad on their muscles. So they come in, if you can drop 20, 30, 40 pounds, you walk so much better. Your back feels so much better.
Yeah. Right. And then they'll want to get up and move around, even just moving around their house. Absolutely. Compared to like just sitting down. And it's so much better for everything, your overall health in general, So I think we're too stagnant. We have the Alzheimer's and dementia risk is really bad, the cancer, all those things. If our body doesn't do what it's supposed to do, if it doesn't move properly, eat the right stuff, and we don't all do it all right all the time, but
it all goes hand in hand.
It's all connected, definitely all connected. And then for the mouth, there's also all this inflammation. So the cancer cells get inflamed, they start proliferating, so then they form a cancer. They become a cancer with our cancer cells we already have. And the Alzheimer's or dementia, they've actually found the plaque that's in the mouth is in the brain. So they can take the dementia patient, of course they don't take it out when they're alive, a deceased dementia patient, the plaque that's there that they know they had dementia or they had Alzheimer's, and they test it compared to the mouth bacteria, it's the same bacteria. So we know that that's all related. And if we can decrease the inflammation, which is swelling everything, which is for all these issues, we could decrease a lot of these causes, even the mouth stuff.
One of the other things that it does, I'm sure I'm stealing your thunder for the next item, but
go for it.
It also helps reduce the acidicness of the stomach lining. One of the things that it does is it slows the digestive system down, where your food stays in your stomach for a longer period of time. You don't have that reflux. So as it battles that, you're less likely to have either gum disease or decaying teeth because of acid coming up.
Acid, yeah. And then, we all drink acid too, with colas or energy drinks too. A lot of people drink any carbonated drink, is acidic. So, and even just juices, something acidic. So those two add to, if you have acid coming up, acid going in, it's all passing the teeth. And that erosion is big. Over years and years that you're doing it, you get some erosion. So it's nice to hear that it does decrease that. A lot of people really suffer with all of that, and it's, so that's a huge benefit. I don't think the medicine you take for that's very good for you either. So it's much better, like everything, it's better to get off of it and not have to take the medication for it, even over the counter stuff, compared to, taking what you need to take and hanging out like that for a long time in your life, But the price is always a problem, I think, for some people. So I'm excited to hear about the other options. Some of the negative effects, too, I was going to talk to you about GLP-1 is the dry mouth, though. So we had the positive effects of how it helps with the oral cavity with dentistry. The few negative effects, I think that I can well, you and I can, between the new company that we think we're starting with the Making Wellness, combat some of these problems. So there's dry mouth. We know that's a lot of medication though. It's not just the GLP-1, but the heart medicine, all those do the same thing. And I feel like we could increase this saliva production with using one of the packets that they have in there. We'll talk about that. Decaying teeth also, when you have the low saliva production, and that's the same thing we just talked about. You just don't have it to wash off, so you have the acid that's in there, and the dry mouth, bad breath, all that. And then the gum disease, so when everything's swollen, like we said before, stuff goes in there, then you get the gum disease. So all these things kind of happen also because of GLP-1. So even though we said there was a lot of good for it, there is a few things that it can cause.
Absolutely.
The biggest one probably too that I thought about was muscle loss. So that's a big one that everybody talks about, is that the GLP-1 is supposedly eating our muscle instead of eating the fat in the right spots. You want to tell me about that?
Sure, it can. So, one of the things that we talk to all our patients about is eating protein. Protein is what's going to protect your muscle when you're on a GLP-1. So by eating protein, might cause some other things in the mouth, but it definitely does protect muscle. And then just talking about other peptides, there are some other peptides out there that also protect your muscle, like glycine. Glycine's a muscle builder. And, if you look at some of the trainers, I know your son's a trainer,
yep.
well known here in Baton Rouge.
Yes.
So if you talk to the trainers, they do Semaglutide or even some small doses of testosterone and different things. So that also helps build muscle.
Yeah, creatine. I love creatine.
Absolutely.
And I'm laughing about the protein because I get fussed at all the time about the protein. I'm just not huge. And I go in waves, but I'm just right now not a big protein person.
Yeah, it's hard. It's hard to eat just protein, but that is truly what builds and protects muscle.
Yeah,
so.
It feeds itself. So, I do Botox and filler at the office. And so I was thinking, like, wow, we start losing weight and you start seeing these people and that they've lost weight, which is great, but we also lose weight in our face. So it's kind of everything starts to sag. We've got a buccal fat pad, you got collagen everywhere. And so once that all goes too, we can help treat it with some Botox. We can tighten up the muscle. Filler, we can kind of fill back in some of the spots for those. So we even the muscle loss, we have combat for facially wise and all systemic. So I think that is a great way to talk about our new partnership with the new company, which is Make Wellness.
Yes.
Which is very new. Just started in March, right? Just launched in March.
Just a few months old. So a baby new company, which has some great options for us to aid with the GLP-1s and the peptides that we're talking about, but then also for people who can't afford those peptides, people who don't want to take a peptide, don't want to do an injection. There's so many people that are I want to say. Some people love where we are, but then some people don't. Anti-injection or fearful of injection.
Fearful.
Plenty of people are just scared of needles, and you have to have.
Believe me, I know.
You have to have an alternative for them, and this is a great alternative where they can either do it through dissolving in a drink or through a capsule, and it's like just taking a pill.
Yeah.
So the one good thing about it, though, is it's all natural. And, when we talk about synthetic injections versus natural, plenty of people like the natural feel of it. They want to be able to say, okay, I want to control what's going in my body. I want to know what's going in my body, and I don't want it produced somewhere. So you got to cater to all types of people. And, some people just aren't comfortable with putting other things in their bodies. And some people just want to do natural things. So.
Yeah. And I think it's exciting that we get to have the best of both worlds almost. By being able to use that for people. I think everybody can benefit instead of them feeling like they're not able to do this one thing that everybody else is doing. Might have some, what is it, mofo or something, fear of missing out. FOMO. See, I dyslexic moment. Mofo. I'm not dyslexic. FOMO. That's what it is. So I'm out of the young people game.
You're trying to go in with the needle. It might be a mofo moment. So.
That's exactly right. Yeah. People are like, no more. So when we talk about the new company and the things that they have, I kind of was thinking about the decay cavities, the periodontal disease, those kind of things, the dry mouth issues. If they want to take the peptide and they will have those issues, or if they take in the medication for the heart disease and the strokes and all the things, diabetes, then there is a packet that you could do for a hydrate is what it's called.
Yes.
Hydrate, put it in your water. So I know My dad is a terrible water drinker, so he drinks this strawberry, nasty water. It's so gross. But he just doesn't like the taste of just water. And I hear that from so many people because I tell them all the time, like, you need to drink more water, your mouth's dry, or you're more cavity prone, drink more water. And they're like, oh, I just don't like water. So this is
not
a
many
great
people
thing, and
want
I've
to
tried
drink
it.
just
It is,
water.
yeah,
It does taste good.
it's good.
I don't know if it's very addictive that, hey, I want another one right after I
Yeah.
drink it, but it definitely will hydrate you and it will stop the dry mouth issues. And
Right.
it's obviously something that athletes can use. And right before they go work out, they want to stay hydrated during their workout. It's definitely a good thing for them.
Yeah, I think it's going to be great, a great benefit. And then I think you can add that together too. So the other benefit that we talked about was the fat loss, which is a big one. And I think that's why a lot of doctors don't even want to give the GLP-1s to some people because they're going to lose fat in a different direction and they're not. And I know Spencer, the trainer, that my son, he gets a lot of patients that are people that didn't work out before, don't work out at all, didn't want to work out. And so the doctor is sending him the people, it's a lot of guys that are bigger and they're losing tons of weight, but there's just nothing in there. So they're just not healthy. I mean, we can be skinny fat all we want, but then you're still going to die young you might look good in the coffin, but it's not doing us any good.
Right.
There's no longevity there. So I know he is really big on building muscle, doing weight training. And at certain
Absolutely.
ages, it's different things. For me right now, it is weight training. And if anybody that's on a GLP-1 definitely should be weight training.
Should definitely be doing weight training. Cardio is to lose weight. So
Right.
the GLP-1's already helping you lose the weight.
You don't have to
so
run.
don't worry about the cardio as much as the strength training.
Yeah, and add it to there. And then Make Wellness has
Something
a
called Fit.
Fit.
And it is a capsule that you take, and it helps build muscle.
I think that's the lean. Fit's the powder.
It's the powder.
'Cause I
That's
tried
right.
it.
That's right. Lean.
Yeah.
Lean is the
Lean is the
capsule.
pills. So so Fit, the one we take, helps build muscle. So even if you're taking a GLP-1, it'd be great to add to that because
Absolutely.
then you can't say that you shouldn't work out still, but I mean, probably would help.
It enhances. It enhances
it. You should still work out. You should still lift weights, definitely. But it is definitely going to help because it is hard to keep muscle on. And the older we get, the harder it is to keep the muscle on. And of course, every time we have more stress and our jobs cause stress and our kids and everything else, then our bodies, our cortisol levels going up. And that's a whole nother problem that we can have, which is also, not helping with all the things. So I think the Fit is going to be great for people who are on GLP-1, want to take the injections, or that don't want to take it.
Right.
And the ones that don't want to take it can also take what you said. Lean, yes.
Yeah. So lean is an alternative from taking an injection if you don't like needles. It still, again, it's all natural, and they can get it at any time. So.
Yeah. No, over the counter. You don't have a
over the
doctor.
counter.
You don't
Right.
have to. You don't do insurance, but you don't have. You don't have to
Right.
worry about it because it's not going to cover.
And
Doesn't cover.
it is very affordable. So
Yeah, and much more affordable
Yeah.
because GLP-1s can, like you said, get very
they
expensive.
get a little expensive.
So I think that's going to be a great niche for people who can't afford it, but still need the weight loss and still need
Absolutely.
for their health go down.
And we see a lot of
Build muscle.
trainers promoting both of them.
Mm-hmm.
You want to be fit and lean, so at the same time you're building your muscle up and you're actually losing the fat with the lean. So
Yeah.
it's still a new science. There's still breakthroughs happening every day, but there's things out there that help people, and that's what message we got to get out to all of our viewers, to all of our patients. Is there is help, and we don't cater to just one type of patient. We don't cater to just one type of peptide. Like we said, if you want injections, we can do injections. If you don't like needles, we can do the more natural. If you like synthetic, it's great. It's made in a laboratory. If you want it natural, we can get it. So just really want to make sure that the whole audience understands what peptides are. It's amino acids. It's things that were naturally in your body that we're either trying to enhance or bring back to life. NAD, you're born with NAD in your body. And by the time you're 50 years old, you lose 70% of it.
Wow.
And by taking an injection, you're building that back up. With the natural peptides and supplements, it's obviously a little bit longer period of time because it's not getting injected right into you, but it is still natural. You talked about the face sagging and stuff. By doing natural things, you're not going to have as much of that sagginess because you're not going to lose weight as
Fast.
quickly.
Yeah.
And it is more of a natural look that you'll have from
Yeah.
it. So all pros and cons on different things, just like every medicine out there.
Yep.
But there's a lot of choices. There's a lot of opportunity to help people. And I'm so looking forward to opening this next endeavor with you and making sure that we help people from a holistic standpoint.
Yes, it's so cool. Thank you so much for coming. That was all great information. It was a lot of information, like you said, overwhelming. So I will be doing more of these definitely to get, we may have to break it down a little bit more from a lot of people, for me, for everybody that's, involved.
Absolutely.
It's a lot. So our big goal is just to help everybody and educate them, but then also give them the right information and give them tools to use, and they can pick which tool they want to use, and just get everybody healthier would be a great idea. So I'll have to have you back again later.
Absolutely.
Definitely.
I'll be back. Thank you.
I appreciate it. And we'll have more information, of course, on our Facebook page, Instagram, website, all the things, Smile Spa you can find, the YouTube channel, of course. And we will see you all next time. God bless you and keep smiling.
Keep smiling.